And Grammy-winning artist SZA is opening up about her decision to get her breast implants removed. The singer says she didn't know enough about the potential risks of getting implants, but with a family history of cancer, she grew increasingly concerned when she began feeling off. ABC's Ariel Reshef has her story.
She's known for raw hits like Kill Bill and Broken Clocks. Now, four-time Grammy Award-winning musical artist SZA opening up about her very personal decision to remove her breast implants.
She was telling me all these things about, like, my testosterone levels and PCOS and all these things that, like, I was plagued with but didn't really know what was actually happening to me.
The 34-year-old sharing her story on the SheMD podcast, hosted by former fashion designer Mary Alice Haney and OBGYN Dr. Thais Ali-Abadi, whose patients include SZA and other stars. SZA says her mother had breast cancer, and her doctor says the star had previously dealt with non-cancerous lumps in her breast.
You had a fibroadenoma, which is a benign, breast mass that a lot of young girls have.
While not linked with breast cancer, doctors say implants can come with some other potential risks. SZA admitting she was supposed to consult Dr. Ali-Abadi before going under the knife.
And I was supposed to see you before I got my breast surgery, but I didn't. And I, like, snuck, kind of, and got it anyways.
SZA says her implants did not last long.
So basically, I put them in. They ended up hurting me. I got way too much scar tissue. I didn't feel good, and it was painful. So I took them out.
Today, she's feeling good and heading back to the doctor soon.
I just scheduled it.
Good.
Thanks to Dr. A's office, I just scheduled it.
And while most data indicates that women with and without implants are diagnosed for breast cancer at similar rates, it's important to note that women with implants do require additional images taken during mammograms to improve the sensitivity of those tests. Diane?
Ariel Reshef, thank you. And I want to bring in ABC's medical correspondent, Dr. Darien Sutton, for more on this. Dr. Sutton, a lot of people get breast implants for aesthetic purposes, like SZA did. Others might get it for reconstruction after breast cancer. What are the potential risks involved in getting breast implants? What do people need to know?
Great question. And I have the same question I asked my friends and colleagues in breast and reconstructive surgery, and they listed some key points that everyone should understand before any surgery. Number one, the risk of surgery alone, bleeding and damage to nearby structures. And then also with breast implants, excuse me, specifically, the risk of pain, scarring, the rare risk of rupture, and what we're talking about today, the rare risk of certain cancers like squamous cell carcinoma as well as lymphoma. Diane, these seem to be most associated with older forms of breast implants that are no longer used, but that rare small risk does still exist.
So this isn't an increased risk in breast cancer, it's an increased risk in other cancers.
Exactly. Separate but important cancers.
Now, SZA removed her breast implants. We've also heard of people getting a double mastectomy to reduce their risk of breast cancer. Yes. What do people need to know about these decisions?
Well, I think in this topic, number one, it's important to talk about it just to provide more awareness and education. But if someone is in that position, this is not a call to get your breast implants removed. Generally, they are safe. But just important to, number one, be aware, be breast aware, making note of any changes in your breast in terms of skin changes, pain, or any swelling or discomfort. Those are symptoms you should bring up with your doctor. Also, just making sure, number one, that if you get any type of implant in your body, you keep the information about that implant. We often have these things called device cards that have information on them. And then lastly, and most importantly, when you're getting your mammogram, calling ahead to make sure that they have experience imaging breast implants. And you might want to consider other forms of imaging like MRIs or ultrasounds.
And what else should people with implants be aware of, or people in general who are fearful of breast cancer and they want to do more to protect themselves?
I think just staying up to date with your screening is the most important. Regardless of whether or not you've chosen to have implants or not, making sure you get those screening tests done, talking to your physician and your surgeon to figure out the best plan for you. Each and every person has different choices depending on their risk factors, but keeping up to date on that screening is most important.
All right, ABC News medical correspondent Dr. Darien Sutton, thank you.
Of course.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.